Okay, those of you that have joined, what we usually do is we go on into the chat and put your name, the name of your company, and your phone number, because there may be others on the line that may communicate with you. Sometimes you all can back each other up on care or transferring clients to someone that has the personnel. So I always like to have several agencies that I could count on and that could count on me. So that's why I want you all to communicate with each other. We're all kind of shooting for the same goal, and that is to provide excellent care to those in the community. And we just need to make sure that we help each other in doing that. There is plenty of business out here to be taken care of, and it's just us stepping to the plate and being able to do that. And doing it as a group will really, really help. So I'm not going to try to keep you all too long today. I'm going to go over what I thought might be pertinent for the beginning of the year. We kind of talk about some of these things all year long, but I've been reading a few articles looking at what home care concerns are for right now. And that's what I would like to do today. And hopefully it'll bring up some ideas for you all. So for this year, as far as home care licensure in North Carolina, there have not been any updates since 2018. We're still following along with what they asked us to do in 2018. I hope that all of you went into your policies and revised them so that you are up to date. If any of you work with me, your policies are up to date from 2018. If you were approved as an agency after the end of 2018, then you have new policies. Some of you that have been around longer, you may need to go in and revise your policies with the new rules and regulations. So I have not heard anything about a new policy update coming out this year, but when they do, they usually issue it ahead of time. They allow us to make comments on it, and then they will let us know when it's in effect. So I'll be looking out for that, and they'll let you all know as well. So we know that cost of goods is a concern. Even not looking at the staffing yet, if you buy things like you're supposed to supply PPE for your employees. When I was in the business, the only thing I had to be concerned about was making sure they had gloves and maybe every now and then a gown if someone had shingles or something like that. But today, you all are also having to supply masks. And I know we had that mask shortage in 2020. So what you all ought to do is make sure you keep masks on hand, because we never know when we may have to go back full mask. I don't know what you all are requiring of your employees now. I know it's kind of optional. So I'd like to hear from you all later on how you're handling that. And those masks are probably more expensive. I know I still buy gloves from time to time, and my gloves are much more expensive. I used to get my gloves I was using the latex free and the powder free, and I was paying less than $4. And I was buying them by the case, but I bought just a box of gloves a couple of months ago, and I paid $9. So I don't know if you all are experiencing that, but that is a huge increase. And we know staffing is still a concern. As I mentioned previously, there's a lot of business out here. Lots of people need help, but it's just keeping those employees ready to go when someone calls you for assistance. Okay, so I'm going to go a little bit more into staffing. And this is something I did when I was in business. I was always hiring, always hiring. I always kept a page on my website that said we were looking for employees, and it briefly asked for several generic things. Of course, you can't ask people for full personal information there, but I'd ask them for their name, where they lived, because that was helpful to me, what type of position they were looking for, if they were certified or not, and just a few other things. Of course, once they filled that form in, it was confidential, but it came to me on my email. So I would get those constantly and I would file them. And back then, I would run ads for employees. So when I ran an ad, I might get 15 or 20 people that might go to my website and fill out that form. And I always printed those off and kept them, because if it wasn't someone that responded that I needed to work right then, it allowed me to create a file that I could go back to. Say if I needed an aide in Spring Hope, I would go back and look through there and see who lived in or near Spring Hope, and I would start to call those individuals. That just reminded me also that there were some people I may have called 5 times over a period of time, and they were working. They were like, no, I'm working. But I always call them again, because you never know if their schedule has changed and maybe you need someone at night and they're working during the day. But I always recycle back through. Also, some of them may have a client, their client may go in the nursing home or pass away. And you know what? They're going to think about you because you've been calling them for work. So they may call you back and let you know that they're available. Also, you all have mandatory training that you have to do with your employees. And then also, if there is new equipment or something like that that you need to introduce, your nurses need to train them. That training needs to be easy so that they can get to it. If it's something where you need to train them on a piece of equipment in the home or finger stick or something like that, of course, the best thing to do would be to go into the home and do that, have your nurse do that. But as far as their mandatory training, you need to make that really easy for them so that they can do it and you can have your files up to date. And then I know you all are still dealing with higher wages. The last I checked, most agencies were paying $15 or $16, and I'm not sure if that's the same, but I'd like to get some input from you all on that just to see kind of what's going on in the area. So there's probably other areas of concern with staffing, but I know all of these are out there. And this is nationwide. This is not just North Carolina, but this is definitely what I know you all are going to be looking at throughout the year. So I think it would be a good idea to just get this in your head that you're never going to just hire X number of people and stop. You need to always cycle them through because your aides are going to be coming through like that. And then as leaders, I wanted to talk to you all about how you manage your time. This is a great time of the year for you all to go ahead and look at how you handle your time. When you get requests from your employees, as I had mentioned several times in the past, when I looked at this business, there's 2 major groups of individuals that you're dealing with. You're dealing with your employees and your clients. So it's important that each one of those gets managed effectively, that you respond to them, that you treat them well, and then they're side by side as far as importance, but you're transferring back and forth. You've got to make sure they work well together. So that's a lot of coordination, and it means you need to be organized. So one of the things I really stayed on top of was if there was a call that came in from an aide, I made sure it was, to me, it was just as important as a client calling in. I would always get back to them, and sometimes they didn't really want anything. They just needed to let me know that the client behaved in a certain way or a family member said this, and you just have to be a listening ear. So be sure you treat those calls well. I think most of you do that with your clients. You get back to them, get back to the family members. But it's so important that you treat your employees well because you want them to stay with you. There are aides that have told me they probably could make more money working someplace else, but they didn't feel respected. They wanted to work someplace where someone looked out for them, where if they really did have a concern with their case, you would listen and that you would advocate for them. Now, you're going to be judge and jury a lot between what the client said and what the aide said, but you have to always stand in the middle, and they need to know that you want things to go well and to be done properly. You need to stay informed of things that are going on in the industry. That's what we're trying to do each month with these calls, is to let you know what we see that's going on. And you all see things that I may not see. So this is informative for me as well. You can get trade magazines. There is one newsletter that I get from Home Healthcare News. They put out a lot of information and newsletters. It used to be free, but now it's a paid service. So you can decide if you'd like to do that. Also, if you're on LinkedIn or Facebook, you can become part of groups. You hear things that way. So just make sure that things aren't coming at you that you know nothing about and you have no one to go to. As far as organization, you all know I am a stickler for being organized and keeping your records up to date and in place. So this is a great time, the beginning of the year. You can kind of look back to last year and see what kinds of things, look at what kinds of things kind of trip you up. Were you making sure that you got your evaluations done? Were you sure that you were checking the healthcare personnel registry? Are your TB tests up to date? Your evaluations, whatever it is you need to do, get a system in place right now, and it will just help you so much because those are predictable things. You can make sure you have those things set up because you know they're going to happen. But I know that every day that you all get up, you don't know what's coming in on that telephone as to what happened overnight. Did one of your employees have an accident? Are they sick and you've got to refill their cases? Did something happen with a client? Is there something going on that you need to intervene? You need to have everything organized that you can control so that you can step into those situations that are out of your control, but are things you really need to pay attention to. And so as I do each month, I like to let you all know that I'm so happy to provide this information for you all. And I'd like to let you know that before you make any changes to anything that you do with any of your payers or your rules and regulations, that you go directly to them and make sure they want you to make that change. But hopefully what we cover here will give you somewhat of an idea of what kinds of things you need to look at. But don't change anything until you're sure that the regulatory agency has let you know that it's the correct thing to do. And then if I bring up something, you all can also call me and I will look further into it, and assist you before you make that change. So what I'd like to do today, I hope you all will share a little bit. I'd like to know, are there things that you're looking forward to this year or that you are apprehensive about, that you feel like you may need help with, or can you remember some things from last year that you want to do better in 2023? So feel free to open your mic and let's have a short discussion. We're way ahead of time. We'll at least be on another 15 minutes unless you all have something else. I was just talking to Frank earlier and we were talking about finding nurses. I know nurses are really, really hard to find and that some of you may need an additional nurse or whatever. Does anyone have any ideas as to how you can go about finding nurses? I'm sure you're having to bring new nurses into home care that maybe haven't worked home care before. But any ideas along those lines? One of my clients was able to get someone that worked, I think she worked nights in the hospital, and they were able to get her to sign up with their agency to work during the day. Now, when you bring in new people from the hospital and areas that have not worked home care, as an owner, make sure that they are trained because they're going to be doing things differently than they did in the hospital. So you make sure that nurse knows those rules and regulations, what she's responsible for, that her job description is clear, and that she knows what you really need her to do for your agency. Are there any comments?
Well, yeah, that's a good question, Patty, because obviously a home health nurse or someone who's been in home care is pretty simple for them to figure it out and step in. But for someone who's been in a clinical setting, what is the best way? I mean, we have a good, clean job description. We have the care assessment. We have all the skills that they're supposed to validate and check off and everything like that. And then I guess, is it going through the requirements, just reading through all those and feeling comfortable with those requirements about what the caregivers can and can't do and that sort of thing?
Well, when I think about the policies and procedures that you all have, each agency has. The client care policy is a very good one to have your nurse to read. Now you've got the administrative policy. That's kind of more of what you'll do as the owner, but it has things in there too. Then there's the client care policies, and then there's the personnel policies. But for your nurse, I think it would be good it's a lot for her to read everything, but to have her read the client care policies, that lets her know what she's up against as far as making sure that she does the visits on time, kind of what the expectation level is. And a lot of you may have your policies electronically. My suggestion is that you also print a copy and have a copy in the office so that if the nurse comes in or whomever, they'll more than likely be your nurse, they can go to a page and read it and just make sure that they know what they need to follow. They can go online too, but it's good to have a hard copy. I used to go to my hard copy a lot when I was looking for something. But Frank, I think if you let them read your client care policies and procedures, that will help, and it may prompt other questions. But they need to know they're operating under different conditions than they were in the hospital. And sometimes you will get a nurse that worked in a hospital or a nursing home, and they may go into way too much detail with their assessments, or they may go in the home and concentrate all their time on the physical aspects of the client and not look at how important the home environment is. A home care nurse needs to get in the habit of, when she pulls up to the door, right then your assessment starts. What is the driveway like? What is the parking? What about walking into the home? Are there broken steps? Once you get into the home, the scatter rugs, all of those things. Is it cluttered? That's how a home care nurse has to do an assessment. She does that for the safety of the client as well as the safety of her employees. Because if you go to a house and say they have a dog and the dog is not restrained or whatever, there was a house that I used to go to, the dogs were tied up, but they were so bad, didn't get out of the car because I was afraid they were going to break their chain because they'd start jumping up in the air. So I would wait for the client. That is clearly something that your aide needs to know when they go to that house. So that's how you do that assessment. Now, a nurse coming out of the hospital, she may just bypass all of that, go in the house and just start telling Miss Jones, let me look at your skin, take off this, take off that. All of that is true. But she needs to know that the environment is so important. She doesn't have to do that in the hospital because the environment is already set properly for care and safety. So that's one thing. Have them look at the client care policies and to learn how you really do an assessment in home care, because what you have is every one of these homes where your aides are working, that is a facility. That is a work facility. And so if your employees get hurt in that facility, they've been hurt on the job. And you don't want them to get hurt for something that could have been assessed and addressed by your nurse before your employees go in there. That's probably the best way. Yes.
Yeah, we put out a posting and we had 0 hits on a nurse, and then we put one out for a case manager, and we got a number of hits on that. So it was kind of interesting to find out that who knows how they what the algorithm is behind it, but.
So you're saying the nurse responded as a case manager rather than when you put it out as a nurse? Is that what you're saying?
Yes.
Okay. Y'all hear that?
Yeah, you need a nurse.
Yeah, you need it. So did you say RN case manager?
I didn't put RN in the title. I mean, I did put it in.
You just put case manager. Okay.
Mm-hmm.
Well, that's something that the rest of you may try. And then when you get them in, just be sure you train them, because the nurse is the heart of your business. That nurse, if that nurse does not know what her job is and she doesn't do it properly, then a lot of things could not be up to standard or could not be compliant. Nurses know about compliance. They will do it, but they need to know what the standard is and what they're supposed to be doing. But if you never tell them what they're supposed to do and they're operating on some other standard, then that could get everyone in trouble. There is no nurse in the country, I'm sure, that wants to put her license at risk by not doing things properly. So if you give her the information and let her know, he or she know, they will do the right thing. But it's up to you as the owner to make sure that they have the information. I mentioned something about wages. Was that figure that I gave to you all about $15 or $16? Is that still a good figure, or are you all having to go higher at this point?
We have not raised ours. Those are our rates.
Okay.
I don't know how anybody else is doing.
Debbie?
It's ours too.
Debbie, you're right in there too?
Yeah.
Okay, good. Is there anything else? Can you all think of any significant problems that you had last year that you feel like you want to do better with in 2023, other than the staffing?
Staffing.
Yes.
And I want to be better at, like, I just, like, we'll have phone calls and be in the middle. We talked about this, I don't remember, maybe once or twice at least last year. But right in the middle of the phone call, the applicant, a lot of them don't even, like, they'll apply and then not even answer the phone when it comes time for that. Or when we usually have an initial phone call with them, and we may just start off and be just a couple of basic questions, or, getting to know one another, and they just hang up the phone right in the middle of the interview.
They'll hang up the phone in the middle of the conversation?
Yeah.
I don't know what you can do about that, other than I will say it this way. If I was on a conversation with someone and they hung up, I would find a way to be happy that they did, because you don't want that person working for you.
Yeah.
Whenever if I put out an ad and someone applied with my agency, I started clocking their behavior right then. You called, I gave you an appointment to come in to complete your paperwork. Did you keep your appointment? Were you there on time? How long did it take you to complete your paperwork? Were you organized? You're assessing things about that employee right the whole time, because those are the things that are not just right. Those are the things you're going to have to deal with once you give them an assignment within your agency. So if someone doesn't follow through during the interview process, or they do something like not even get through a phone conversation, you don't want that person working for you. So that's unfortunate, but I guess that's a sign of the times. They have so many different places that they can work now. So that's probably what that is. And I don't know how to combat that, Frank. You just have to keep a lot of people in the pipeline and hope that you'll get some good ones out of that.
Thank you. That's it. I appreciate that encouragement.
Yeah, that's how you have to look at it, because it's going to happen. And you all don't need to take that personally, because that's on them. It's not on you. They didn't even give you a chance to hire them. And thank God you didn't go through everything and spend the money to hire them and have them behave that way. Okay. Well, I thank you all for coming today. I wish you all a happy new year. I hope you have a wonderful year. I'm hoping that hopefully the salaries or the wages will stay the same and not shoot any higher this year. Hopefully they'll stay around, what we discussed. And as far as employees, one of the things that you can look at, and I did this as well. I know you have clients that have to have someone that's certified or on the nurse aid registry is what I should say. There are clients whose level of care requires that you have a person that's on the nurse aid registry working with them. But there are clients as well that don't have to have anyone on the nurse aid registry. That is an opportunity for you all to reach out to individuals that are not necessarily home care aides, but the perfect ones that I remember are people that were individual caregivers at home. Like I had this one lady that worked for me. She had taken care of her dad. She was not on the nurse aid registry, but they had taught her so much. And I brought her into my agency, and she was so good with men because she had worked with her dad and he passed away. So there are people like that that you meet at church. You see them all around. Those are people that you can bring into your agency, do their initial training, do the bloodborne pathogens, get them all lined up. You can hire those individuals to help some of those clients that don't need a nurse aide, and then utilize your other, those on the registry. You can utilize them more effectively. So just keep that in mind. It's going to be touch and go with that, but that's an opportunity for you all to bring other individuals into the industry that have not been in the pool. And if your agency can learn how to do that well, you got to make sure you put them with the right client, with the correct number of ADLs and all of that. But that gives you some extra arms and legs that you can have in your agency, people that are not already working in home care. Any other questions? All right, you all take care. We'll be back here next month on the second Friday at 1 p.m. If you all have a subject that you would like for me to cover, feel free to email me and we'll look at putting that in over the year, or we can, add it in at any time. But feel free to do that. If you know others that are part of the industry that would like to attend these meetings, it's open to whomever would like to come. We're glad to have you. And thank you all for coming. Take care. And I will see you all next month.
Thank you, Patty.
Thank you. Right. Bye-bye.
Thank you so much.
All right. Bye.